I want her to be able to go out there and play. She's not able to do that. I want her to be able to have friends, go to school, mix with people, mingle. But that's the future I'd like for her, to have a typical life and just be a child. Yeah.
Approximately 6 million people worldwide are affected by a primary immunodeficiency. Unfortunately, 70 to 90% of these are living undiagnosed. Primary immunodeficiencies are a group of rare, chronic disorders characterized by an immune system that is not functioning as it should. Individuals affected by a primary immunodeficiency are susceptible to recurrent infections, autoimmune conditions, and other complications. These conditions are largely genetic, but in some cases can be spontaneous. Now, World Primary Immunodeficiency Week is celebrated in the last week of April every year. This year, for World Primary Immunodeficiency Week, we have come together under the theme, See the Unseen. The aim is to uncover stories behind people affected by primary immunodeficiencies, while calling for a collaborative effort between the general public, healthcare professionals, and the primary immunodeficiency community at large to ensure that we drive earlier diagnosis, have effective treatment plans, and ultimately save lives. In this part of the series, we are joined by Hellen Ayaga, who is a mother to a beautiful daughter living with primary immunodeficiencies, and she will be here to share her stories with us in line with this theme, See the Unseen.
Okay, my name is Hellen Ayaga, mother to 5 beautiful girls, from the age of 15 to 5. Well, first, my daughter has, apart from a PID, she also has Down syndrome. So in the beginning, when she was born, of course, the first thing we noticed is the Down syndrome because of the physical features. And Down syndrome also comes with some immunity issues. So she had this constant pneumonia that was just not going. The doctors were worried. They did everything possible to deal with it, but nothing was, there was no relief. So that's when I came across Dr. Marangu. And as God would have it, she was also handling another child who had a PID. So when she came, she was like, no, I think this is just more than what we think is presenting. And she insisted that we have something called a lymphocyte subset test to check on the T and B cells in the body. And when we did, of course, it came up, it was low. It was lower than normal. It was quite concerning. We started treating her like a patient who has PID from there, even if we didn't know exactly what she had. So I wouldn't call that diagnosis, I'd say just managing. So when we got to know what she had was 6 months later. So this was January 2021, when we did some tests and were sent out to India, where they do a genetic test. And then that's when we got to know exactly what she had, which was confirmed now that it's a PID. I think everything, especially when you're looking at your daughter and you're seeing something is wrong, and you're doing test after test after test, and nothing is confirming or nothing is, you're not really getting to the answer of it. It's challenging. Apart from financially, it's also challenging emotionally, of course, because sometimes you want to know whatever is happening, no matter how bad, then you deal with it. So it was quite difficult for my family at that time. But even if we were already treating her as such that she did have a PID, we're still doing other tests. So we did even our D. George tests. We did everything you could think of, and that's finances, and they're not cheap. And most of them you have to send them out. If it was in Lancet, it's South Africa, India. Well, we know how COVID was for people, in terms of people losing their jobs and stuff. So it was crazy. Yeah. So when we did know what it was, even if it's not the best of news to get, it was still a relief for us. Yeah. Right now, I'd say it's easier. I don't know if it's easier because we have a routine. In the beginning, it was crazy. So she had a nurse for the first 3 years of her life, and caring for her meant, of course, I'm a stay-at-home mom now. So it meant us taking turns. Like we could not slack. She was on oxygen for the 3 years. Of course, the persistent infection, so we're in and out of ICU. When you go to sleep at night, you can't really sleep because you don't know, what would happen. So at that time, me and the nurse would take, during the day I'd be there and she'd rest, and at night, Shizan would take over. It's better. Yeah. It's way better now. Yeah. I think it's the hidden. Let me just answer it in a different analogy or something. Like when a woman is pregnant, I think the worst you always think is maybe getting a child who's physically not okay. And I'd be like, oh, as long as my kid has 10 fingers, 10 toes, eyes, And when you do get a kid or a baby, and your baby turns out with the 10 fingers and 10 toes and ears and everything fine, you think then you're okay. But then, when my baby has her 10 fingers and 10 toes and everything else, but she had something else. So that made me see things differently. So see the unseen, I think it's just more to be aware that there are other things other than what we see in our day-to-day lives, that we're different. And maybe if we see that difference, we can embrace it. Yeah, I don't know if that makes sense. But yeah, let's embrace it and just know that not everyone's the same. And maybe that can I don't know. Well, it's helping, but it's a small thing that, I can go a long way to know that you shouldn't take things for granted. There's some things that happen that we can't really see, but Okay, for the doctors, I'd say listen to the parents. Even if we might not have the medical terminology or not know anything medically, we live with these children. There's some things we do know. So listen to the parents. Let's work together in this. Let's go in this journey together. Also encourage them to, to stop having a one-man show. Like, just work together. If there's something you don't understand, ask your colleagues, read about it. We are all learning in this journey. And be willing to listen a lot. For the policymakers, we have a long way to go. One of the treatments that she receives is IVIG. It's very expensive. But IVIG is not only for PID. There are many other conditions, or not only rare diseases, but even other conditions like lupus, just any other autoimmune condition that needs IVIG. And you don't have, if you put all those people together, that's a big number. So maybe use that to do something about making it more affordable or even accessible, because not all hospitals have IVIG, very few. Like for me, I had to change from a hospital she was in before because they didn't have it. And now where she's been going, I would like to go somewhere else because it's cheaper. I think it will be cheaper somewhere else, but I can't because that's where she does get her treatment best. SHA used to cover IVIG in Kenyatta. I don't think it does anymore. Maybe the government should look into that. But apart from treatment, also, just early diagnosis of what's wrong. I think that is something that they should just put in and say, when a kid is born, then you have the BCG. Let's also have that. And the diagnosis then have to mean it's being expensive, like getting the blood and sending it out. But just looking at some markups, do they have this, do they have this, then you say this person might have, or this child might have this, and then push them to the next level, instead of just ignoring anyone who has an issue that's respiratory. It's pneumonia or malaria or the usual. We are way past the normal, quote unquote, diseases that have been there. Yeah. For the parents, I'll put that in two. So there's the parents and then there's family. So for the parents, I'd say hang in there. There are many different types of PIDs, and we've had people who've actually even gotten healed from it, or, people are living normal lives. Have a good support system around you. It's important to have that. Don't be embarrassed about your child. If you can talk and educate other people about it, go ahead and do it. Just having a support system is very, very important. I'm actually lucky to actually have one that's been very supportive to me. For the community, stop judging people. This child is sick. It's not the parents' mistake. No one knew how things would turn out. Just support the people who are going through this, whether the patients or the caregivers or the parents. Be with them. Yeah. So medically, I'd say what I've just mentioned about the diagnosis, know early so it can be able to manage it. Treatment, hopefully, that it's going to be more accessible. I was going to say normal lives, but I don't know whether I can really say normal lives because, my daughter is yet to go to school. I don't know, it's... I think just take it like, I like saying this, rare is not rare if it's known by many people out there, and treat them as normal. Children or people, don't handle them with gloves. Hopefully my daughter will be handled with gloves because I would want her to have a normal life, because I'm imagining if her life continues as is today, then she's going to miss out on a lot. I want her to be able to go out there and play. She's not able to do that. I want her to be able to have friends, go to school, mix with people, mingle. But that's the future I'd like for her, to have a typical life and just be a child. Yeah.